Good evening, everyone. First, we begin with a problem that continues to plague Erie County, opiate abuse. After 7 people died in just one day from heroin, we're speaking with the individuals on the front lines of this battle and asking what can be done. News 4's Jen Shantz joins us live with this story. Jen?
Melina, I sat down with a paramedic and a former opiate user today. The numbers will tell you we're not getting ahead of this problem. If we continue at this rate, Erie County will well exceed the opiate overdose number from last year, which was 302. Just 3 months into 2017, we've already lost more than 100 people. One thing is clear. Opiate abuse doesn't discriminate. It welcomes people of all ages and income levels. It doesn't care if you live in the city or in the suburbs. Eric Barkey has been a paramedic for 4 years. Like most first responders, heroin keeps him pretty busy.
I've helped patients with the needle still in their arm.
Following a lethal batch of heroin, Erie County officials have urged users to purchase Narcan, which can reverse the effects of an overdose. Barkey works for Mercy EMS. Since last year, they've seen a more than 150% jump in their use of Narcan on patients. American Medical Response, or AMR, says in March of this year alone, they've seen a 46% jump compared to January and February. Twin City Ambulance tells me they get overdose calls every single day. It's a problem all too familiar for Stephen Fogarty, a recovering opiate addict.
You know, just in the past 4 months alone, I've been to 3 funerals for people my age. You know, I'm 26 years old and I've buried 3 friends.
He knew 2 of the 7 victims killed by that bad batch in Erie County. Investigators say it could take weeks to know exactly what the drug was cut with. Fogarty remembers overdosing himself. He never went to the hospital. Barkey sees the same people on some of his overdose calls.
They weren't there with their family or friends and saw them not breathing, saw their color change, saw their lips turn blue, saw them salivating. You know, they don't see that part. So at that moment when I'm trying to tell them, listen, you know, you're lucky, I really don't know if I'm getting to them or not.
But Narcan, he says, works as long as it's administered in time. It's waiting to call or not calling at all, he says, that kills people. I asked Fogarty, who's been sober now for more than 2 years, what he needed to help him stop.
A safe place to be honest, and I know that sounds so simple and it may sound, you know, you may not understand it if you're not using, but the number one thing about getting clean is being able to tell somebody that you're using.
Now, the health commissioner has said this is not the time to kick addicts out of the house or cut them off. Now more than ever, they need our support, a safe place to talk. Anyone with heroin is being urged to throw out what they have because there's no way of knowing if it's from that lethal batch or not. If you or someone you know is struggling, please go to our website, WIVB.com, and click on the Found It on 4 tab. There are resources there that can help you. At 6, a state law that aims to keep people alive by lessening the fear of arrest for addicts. For now, live in the newsroom, Jen Shantz, News 4 at 5.